Hello everyone, I'm Dr Sibasish Dey. I take care of the clinical affairs for ResMed, and probably almost every day we attend patients who have some kind of sleep disorder or are asking questions about their sleep to us. So I think in today's edition we'll discuss about how sleep and immunity are intricately related. So as you know that our immune system and sleep are interdependent, and sleep is necessary for the immune system to operate effectively. So sleep can be impacted by immune reactions, and this can be any kind of immune reactions, like you can have viral infections, you can have bacterial infections. But what we know from different research is that if you are having a proper amount of sleep, then it fortifies the immune system, and sometimes and vice versa. So a healthy immune system actually depends upon how good or what kind of quality of sleep are you having. So a healthy immune system leads to a strong innate and adaptive immune system. Okay. So let us also try to understand why this happens, right? So whenever we are sleeping, we typically release a substance called the growth hormone, and this growth hormone is responsible for healing of the body. So suppose an individual who is getting very interrupted sleep, or is having difficulty in sleeping, or not, or rather getting a very fragmented sleep, or for some reason the sleep is totally disturbed, this production of growth hormone actually goes down. And at the same time, there is a phase of sleep which we call as the slow wave sleep, right? So this slow wave sleep stage is responsible for all the physiological and the biochemical restoration of our body. So suppose if someone is having disturbed sleep or fragmented sleep, first of all there is reduced secretion of growth hormone. There is reduced efficiency of the stage of slow wave sleep, or perhaps that individual does not even reach that stage, so the body does not get replenished or rejuvenated. And at the same time, when all these processes are taking place, there is also something called cortisol which is released by the body, right, during sleep. And cortisol is basically a stress hormone. So this cortisol leads to a lot of issues, so it causes oxidative stress, and from oxidative stress there is free radical generation, which actually causes an inflammation around in the body. So you might see patients who are having disturbed sleep, they land up with different types of cardiovascular disease in long run, or at least if you look at the clinical data, we have seen that these are the patients who actually have association with with heart failure, with arrhythmia, with stroke, with type 2 diabetes mellitus, and so on. And at the same time, there has been a lot of studies which has been done considering that how sleep and immunity is related, and we have also tried to study how vaccine efficiency is related to sleep. And in fact, there has been several studies which say that if a person is sleeping well, perhaps the titer of that vaccine in the patient is much more better than any other individual who is not having appropriate amount of sleep. And this has been kind of seen through different clinical studies at different geographies. So I think very important, if you have to maintain a strong immune system, first of all, of course, you need to exercise, you need to eat healthy, but then I think if you can get a proper quality and quantity of sleep, it actually helps you fortify yourself, helps you build a robust immune system, and you can protect yourself from both short term and long term consequences of any kind of disease, be it cardiometabolic cancer, or for that matter any infectious disease. So I think you like this short video, and thank you for watching.